with the present state of medicine in the United States and really ask, what do you see as the greatest strengths of healthcare in the U.S. and what do you think is its biggest challenge? And I'll just throw it out, anybody who wants to answer that question.
Can you just talk?
Yeah.
Since I guess I am the oldest, I'll start this off. When Brendan said that, I was trying to say it to the microphone driving down here. I was trying to remember what year did I graduate. And I actually had the wrong number. I thought it was 64. That was college. So 55 years next year. I would say that one of the strong points is innovation. You know, we lead the world, I believe, in innovative ideas, innovative technology, and things that we can use that will help with patients. And as we're seeing, more and more things are being done outside the hospital. So miniaturization, different anesthesia techniques, different surgical techniques, and I think that just to get this started, I think that is one of our strong points. I think the challenge for us is this. We all believe that people should have access to healthcare, and that's still a problem. And it's still under review, if you will, by many, many different bodies, including the federal government. And just as you're seeing with some of the things that are going on with the states about the exchanges, and if I'm using things you're not aware of, just let me know. We'll stop and explain a little more. But exchanges, Medicaid coverage, et cetera, and whether these subsidies, which are now probably going to be looked at by the Supreme Court, as far as whether the states can be subsidized for a federal event. It's ambiguous at best, chaotic at worst. And I think one of the challenges for the three of us is it is ambiguous. And so how do you deal with ambiguity? I was sharing with Steve before we started that you know, we've probably changed our budget 3 times this year because we don't know if Medicaid was going to be approved in Ohio, so we didn't put it in. Then it was approved, so we had to put it in. And this is the first time I've seen that. Our budget is $6.5 billion, and to keep changing this every 3 to 4 months is anything but you know, stable. So I think the challenge is accessibility and availability.
Yeah, I amplify on Joe's comments to suggest I think one of the great strengths of American medicine is its foundation in science, and science is moving so quickly and offering previously unimaginable opportunities for us to cure disease and extend quality life. I do think that the biggest weakness right now is our collective decision making about whether we're going to take care of each other. And I think that until our political process kind of comes to grip with that, that the promise of medicine will not be fulfilled for lack of funding, for lack of continued support for research, for lack of structure in which we can provide these transformative new therapies. I also think that our system, for all its strengths and for all the inspiration that I gather every day from working with patients and researchers and clinicians, we still have a collective inability to discuss the end of life and talking about quality survival as opposed to eking out every last week and month. And I think that those are conversations that benefit from the spiritual realm. They benefit from compassion, and they benefit from close dialogue between caregivers and families. But I think we've got a bit of work to do there in understanding what does it mean to succumb to an illness at the end of life, and how should that be approached?
I would just like to add that my major concern at the moment is the foundation upon which medicine in this country and around the world is based is on biomedical research. And we have bipartisan, quote, support for this, but no money flowing to NIH and other agencies. So I'm on an advisory council at NIH, and it's all doom and gloom down there. The cuts of the sequestration are really staying with us. We're at a new low normal, and I don't see any growth in the near future. And what that means to me is that it's going to erode our position as innovators, and we're going to have a lost generation of medical researchers. People are not going to go into science and research because they look at the funding and they say, I'll just do something else. So we're going to lose a lot of very smart people that should be focused on this area, and we're not going to get others coming to this country as we used to. So in my mind, we're doing a lot of innovative things with technology, but the fundamental understanding and the need for new medicines, I think, is going to get eroded over the next decade unless we turn this funding situation around.